I would like to now invite Mr. Jurgen Schwettmann. His name is German, so it's a little bit difficult to pronounce. And former ILO official with more than 41 years of work experience in development cooperation, with a focus on cooperative and the social solidarity economy and the African continent. He's working as the consultant for the UN Task Force for Social Solidarity Economy, and he has been the director of the ILO and also the chief of COOP unit at the ILO. He's taking us now to Africa to share about the impact of COVID-19 on the informal economy in Africa, and what measures and what directions we have to take to rebuild back. Jurgen, floor is yours.
Thank you very much, Lorenz. Good morning, good afternoon, everyone. I will talk about the impact of COVID-19 on the informal economy in Africa, mainly sub-Saharan Africa. Fact one is that 86% of the labor force in sub-Saharan Africa works in the informal economy. So the informal economy is the normal economy of that region. The coronavirus has reached the African continent rather late, but the rate of infection is growing fast. On the 25th of June, when the PowerPoint presentation was prepared, we had 337,000 cases, infections, and 8,800 deaths. Today, I checked this morning, the number has reached almost 400,000 cases and 10,000 people have passed away. And fact three, many African countries face a double or triple crisis. First of all, COVID-19, which is exacerbated by falling export earnings, in particular those countries that depend on crude oil export, copper, coffee, and so on. And the third factor is the fragility due to conflict, climate change, natural disasters. So governments have to struggle with a triple crisis. The impact on the informal economy is similar to what has mentioned by previous speakers. First of all, the informal economy workers themselves are at risk of being infected because of their working conditions, and in particular because of their living conditions. Many informal economy workers on the African continent live in urban slums without running water. It is almost impossible to keep social distancing. So if an outbreak reaches one of these settlements, many people might be infected. Previous speakers have talked about the loss of income, jobs, livelihoods, markets, customers due to the lockdown, the travel bans, border closures, and which have been enforced very strictly in many African nations. And the absence of social protection and government support forces informal economy actors to work even when they are at risk. Currently, only 20% of all households in Africa are covered by health insurance. 80% will have to cover their health expenditures out of pocket. So they have to earn money somewhere, otherwise they have simply will be affected by the disease. Next slide, please. Now, the 47 countries in sub-Saharan Africa have taken drastic steps and very immediate steps to counter the spread of the virus. Risk reduction, lockdowns, travel bans, border closures, as I mentioned earlier. Many countries have recruited additional personnel and massively expanded health facilities, acquired testing facilities, and so on. Many countries have adopted social assistance measures to cover, to support the most vulnerable persons and households. Cash transfers, food distribution, free water and electricity, and also public works to provide some basic income to poor households. Then many countries have taken measures to boost the economy, tax breaks, new credit lines, subsidies, lower interest rates, income support, and so on. That has led to a very impressive and massive efforts in many countries corresponding to 2 to 5% of GDP. But one point which I didn't mention on this slide here is the fact that because African governments didn't have the capacity to finance these measures from out of their own financial sources, they had to rely on external borrowing. Quite often, they had to approach the IMF and the World Bank. Now, there is a risk that these two institutions use the situation to push for their neoliberal agenda, similar to the one that was prominent in the 1980s, 90s with structural adjustment policies. So the dependency of African government makes it difficult to respond to the crisis. Very few countries have targeted the informal economy specifically. And in almost none of these countries, informal economy organizations, where they exist, have been associated with the design of these measures. So it's not sure whether the social assistance program, for example, or the economic recovery programs will reach the informal economy actors and operators. Secondly, the social and solidarity economy is generally not mentioned in any of the response packages, neither as a target nor as an actor, with the exception of microfinance institutions, which in some countries will play a role. And that then leads to the next slide. What can we do to enhance the role of SSE in responding to the impact of COVID-19 on the African continent? First of all, we need to learn from the past. In earlier crises, the crisis of HIV/AIDS, SARS, Ebola, the Zika virus, which was spreading some years ago, how did the SSE respond to these crises? How did it respond to post-war situations, to the regional and global financial crisis, to the past pandemics? We need to document that role to be able to show it to decision makers at the local and international level. We need to create awareness about the SSE as a proven crisis response mechanism. In times of crisis, communities tend to rely on cooperation, solidarity, and mutualism. And I think the example provided by many previous speakers bear testimony to that fact. We need to provide concrete examples of successful SSE crisis response measures. For example, workers' takeovers, was it happened in Argentina 20 years ago with the Empresas Recuperadas. The role of labor contracting cooperatives, microfinance services, mutual health insurance, caregivers associations, all forms of self-help groups, the new forms of platform cooperatives, informal economy associations. If we can provide concrete examples, figures, statistics, we can convince decision makers to include the SSE in COVID-19 response strategies. Strengthen the organizations of the informal economy. Where they exist, such organizations, invite them on the table where COVID-19 response strategies are being decided. Where not, they need to be established. At present, very few countries on the African continent do have national informal economy associations that can represent the interests and the voice of the informal economy, which, as I said earlier, represents 86% of the labor force. Organization building, in my view, is absolutely essential. Fifth, we should promote alliances between trade unions, the organizations of the informal economy, and the social and solidarity economy movement. The three are like-minded. The three have similar objectives. They need to be brought together. And in some countries, that is already happening. Mobilize the SSE to rebuild national societies and economies in a way that promotes decent work in the informal economy and, of course, sustainable development. The issue of building back better. My last slide. I think that organization building is at the core of promoting decent work in the informal economy. Because through collective entrepreneurship, the promotion of service and producers cooperatives, through financial intermediation, through labor contracting cooperatives, employee ownership in the informal economy, etc., we can create jobs and livelihoods, which is the first pillar of ILO's decent work agenda. Social economy organization can extend labor rights and regulations to the informal economy, playing a role in extending such rights, and also adopt specific laws and regulations for informal economy workers and operators. Formal social protection schemes that exist, of course, in most African countries currently do not reach the informal economy. So they need to be complemented by schemes of mutual assistance, mutual aid, community-based health schemes, organize people to participate in public work schemes, promote micro-insurance systems, etc. And in that particular domain, much progress has been made in a number of African countries where community-based health schemes are on the rise. For example, Rwanda is a famous case where almost 100% of all people now benefit from health insurance. But the same is happening in Tanzania and Kenya, in several West African countries as well. Again, the SSE has a key role to play. Dialogue allow informal economy associations where they exist to participate in social dialogue institutions. Social dialogue institutions and processes have been put in place in almost every African countries. But the main actors in the economy, the informal economy, is not sitting on the table because they are not organized and they're not being recognized. That has to change. We need also to foster the horizontal and vertical integration of primary informal economy associations so that they can strengthen their voice and representation and make a difference. So in short, organization building in the informal economy, according to SSE principles and values, is absolutely essential. Thank you.
Thank you very much, Jurgen. I think that his contribution was very valuable because I think that there are very specific characteristics of the African continent with a very high percentage of informal workers, representing more than 86% of laborers are actually belonging to the informal economy. And above of that, they are in greater fragility, not only due to the COVID-19 crisis, but already existing fragility due to conflicts and climate change and so on. And I think he's actually also echoing in the same direction that it's very urgent actually to include them in the discussions with the government for the measures and strategies to be developed, as they are invisible and they are not even considered nor the target or nor as actors to recover the economy. In fact, they are the majority of economy, but they are invisible. So I think many future directions he has shared are very important. Certainly, I think African continent is the continent where we lack a lot of those documents and data to prove what they have been contributing to the economy, and also that representativeness of this informal economy is an urgent issue because we do not have many of those national association or even regional association of informal workers, and urgently need to build an alliance between informal economy, social solidarity economy, and trade union movements. And I think very important suggestions that we have to take for the coming months and years to see how we could make this possible, and especially allowing that through this solidarity and alliance, whether we could able to make a transition from informal economy to the formal economy for the most vulnerable and affected groups of society in Africa. Thank you very much, Jurgen, once again for your very valuable contribution.